First, prepare your sterile material, gown and gloves, and then the equipment required for the catheter. This will include a dressing pack and suitable cleaning fluid, the lignocaine gel, a 10ml syringe for the catheter balloon, some sterile water, and components required such as the urine bag. Ideally you will gown and glove for this procedure, but urgency and resuscitations may necessitate sterile gloves and personal protective equipment. The penis should be wiped clean twice with cleaning solution. We then take the penis at the base and clean the glands and tip more thoroughly, as this is the most likely area where bacteria will be tracked into the urethra. Note the bluey absorbent material under the mannequin for patient comfort and easy cleaning later. A fenestrated drape will help avoid contaminating the catheter during insertion. Have all your material prepared at the outset, including the sterile water for the balloon. This clinician has inserted the urine bag into the catheter pre-insertion, which may be useful where there is no assistant. It keeps it to hand and avoids mess. Now take the penis at the base again and inject the lignocaine gel into the urethra. This will serve as an anesthetic and lubricant for the process. Usually one is sufficient, but difficult insertions, 2 may be required and help. After a brief wait, insert the catheter into the penis. Note it is kept sterile by your field. As a rule, it is good to insert almost fully into the bladder, and this ensures the balloon is in the bladder before inflation. In the cutaway mannequin, we can see the catheter passing through the prostate and into the bladder. This may not always go straight in, and manipulating the penis at different angles to the body and trying different sizes are the first options for the difficult placement. The obvious way of assessing placement is free-flowing urine, and a specimen can be taken at this time for sampling. As there is variation, please check the volume of sterile water required for the balloon and inflate. This is usually 10 ml. Gently pull the catheter until you meet resistance, and it is now in place. The catheter can now be attached to the patient's leg. Please always clean away excess gel or spilled urine and make sure the patient is dry. This is a very unpleasant procedure, and salvaging some dignity is important. There are many proprietary adhesive sets, but be aware to leave enough loose catheter for comfort and also for avoiding injury to the urethra and the penis. Where you attach the adhesive dressing will depend on the patient, and also whether you are using a urine bag or a valve. The urine bag has always been the traditional normality of care, but the valve allows the patient a lot more freedom and is a lot more user-friendly than a bag strapped to the patient's leg. Most cases of retention mean a large prostate, and the coude, or French for elbow, IDC, has a bend in it, which may facilitate placement in those difficult patients.